My name is Leanna Douglas. Everyone knows me as Hope Still Stands. It's based on my journey from hatred to hope because I had a long road with infertility and trying to create a family. And I do everything I can to help others, to inspire others to never give up hope, no matter what they face, no matter what they're diagnosed with, no matter the journey of, planning their family, there is still hope. So never give up on yourself.
Wonderful. Thank you. So let's really start at the beginning of your story. Take us all the way back. When did you start maybe noticing some symptoms or something just maybe didn't feel right?
Yes, actually, for me, since I started my menstrual cycle at the age of 10, I just noticed from there that I always had horrible menstrual cycles, just debilitating periods. And over time, I had my first pap smear at the age of 15, and the doctor said he couldn't see my cervix. So that was another like red flag, like, wait, you can't see my cervix at the age of 15. I wasn't like asked to, get second opinion or I should go see a specialist. So I just knew that my cervix was invisible at my first pap smear. And then over time, I started to just like feel that I was cramping for 3 to 4 days on my right side and then 3 or 4 days on my left side. And when my mom and I would tell the doctors, I'm experiencing horrible periods, so much so that I can't get out of bed. It's hard to go to school. I would have accidents at school. So that's embarrassing on top of the pain. They would just tell me that I was a girl with bad periods. So I was labeled as the girl with bad periods instead of, saying, let's see what procedure we can do or let's do an ultrasound. I was just labeled as the girl with bad periods. So that cloud over my head, like something is wrong with me, like this negative term, being labeled as that. I felt like I was othered. I'm already dealing with horrible periods. So something was just going on behind the scenes, but I wasn't getting the care that I needed. I felt like my pain was being minimized. And then fast forward to meeting my husband. At the time, right before we were supposed to get married, they wanted to do surgery to remove cyst from my ovary because they thought it was a cyst on my ovary, that it went from a tennis ball to the size of an orange to the size of a grapefruit. And I was like, no, this is 2 weeks before I'm supposed to get married. I'm not having the surgery. So after I got married to my husband, I kind of told him ahead of time when we were dating, I'm the girl with bad periods. That label actually said that to him. Like, so I'm going to let you know I'm having horrible periods, but not thinking that the horrible periods, the debilitating pain has something to do with fertility. That was never said to me because I never had the test. I never was sent to a specialist. So I didn't know that that was a connection. So my husband and I decided to wait a year before we start having children. So we just loved on each other, not thinking about fertility until about a year. And we're trying and trying and trying to get pregnant. And during this time, I'm still having horrible periods, cramping 3 to 4 days on my right, camping 3 to 4 days on my left, and having pain at work, having to have to go lay down, popping ibuprofens like Skittles. But again, not understanding that, does this connect to my fertility? And so after months and months and months of trying to get pregnant, we nothing was happening. All of the pregnancy tests were negative. Like doing everything, putting my legs up, putting a pillow underneath my back, and not getting pregnant. So I started to look for doctors, and finally, this doctor sent me for a hysterosalpingogram. And that's when they inject dye into your uterus. And I remember asking if my husband can be in the room. And thank God they said, yeah, sure. So my husband's in the room and they're injecting this dye in my uterus, making me, shift back and forth. And I am screaming. I am crying. I'm pulling at my husband. I'm like, wait, I've had horrible cramps, but this pain is unbearable. And I remember usually when you have a procedure done, you'll get a call the next day or get results in your my chart. Well, the radiologist came in right away. So that was alarming. So radiologist comes in right away and he says, I just want to let you know, Mrs. Douglas, you have a half a uterus. I was like, half a uterus? Wait a minute. I'm here because of the cyst on my ovaries, because of the pain I'm having. You're telling me I have half a uterus. I've never even heard of this. Who talks about women having half a uterus? I was crying, like I was in shock. My husband and I were looking at each other like, what are you talking about? But at the time, it was such a blessing that I was working at the prenatal assessment center at this prestigious hospital. And so I'm frustrated and upset. I'm like, wait, I've been saying I've been having bad periods, and I was labeled as the girl with bad periods. And I was like, baby, can you please take me to my job? I know I'm off. Take me to my job. And that's the thing about advocating for yourself. And if something doesn't feel right, you have the right to ask someone else for a second opinion. And so I'm not a patient of these physicians that work at prenatal assessment center, but because I worked there, their care was just beyond. And I'm so grateful to these doctors. But this particular doctor was a colonel in the Army. And I walked in and I said, sir, he was like, Lena, what are you doing here? And I'm like, I know I had a procedure today and I want you to, if you don't mind looking at my films, can you look at my films? So he's just finishing doing an ultrasound on a pregnant woman. So I'm going through my own fertility, issues, and he's doing an ultrasound on a woman, comes out, puts the films in the screen and cuts the light on. And I remember his glasses on the tip of his nose, and he looked, he says, Lena, you don't have half a uterus, you have two. I said, wait a minute, wait. I'm going from the girl with bad periods to cyst growing on my ovary. Then you're telling me I have half a uterus, and now you're saying I have two uteruses? In disbelief, I'm in shock. And he says, you need to research a reproductive endocrinologist. What is that? These are things that are not talked about. I have no idea. Wait, two uteruses, reproductive endocrinologist. I've never heard any of these terms. All I know is the girl with bad periods. So literally I went home, I'm doing my research, like I'm looking, finding a reproductive endocrinologist in my area, and I finally found this wonderful doctor, Dr. Christina Altman. And I made an appointment, and she says, the nurse says, well, Dr. Altman is going to do a thorough exam. So here's your appointment. This is your date. I was like, okay, my husband's coming with me. So my husband came, and I went back in the room and I said, can my husband please be back here? She was like, sure. I'm just so grateful that the doctors were so accommodating with that, because you're already scared, you're nervous, and then now you're going to do an exam on my body, and I'm already know it's going to be painful. So my husband is in there, and she does a thorough exam vaginally and anally. I'm just being blunt with you. And I thought the Pap smear was the worst pain I experienced. This was beyond. This is beyond. This is the most detailed exam I've ever had. And I'm screaming, crying again, pulling on my husband. And she was like, I can feel your cervix. It feels like you have two cervixes. She could feel that anally. And I was just overwhelmed. And she says, we need to schedule surgery for you. Something is going on, and we need to go inside to make sure, we can really see what we need to see. So soon after that, I was scheduled for a laparoscopic surgery. And I was diagnosed with endometriosis, fibroids, and I was diagnosed with a Didelphys uterus. I have two uteruses and two cervixes. So all that, first, all those things she's telling me, none of the things I've ever heard of. And it's overwhelming. So that feeling othered, now I'm really feeling like I'm othered. I'm feeling like I'm the only one diagnosed with this. I've never heard of this. I felt alone. But she was so, her bedside manner was, on point, and she was so, gracious and caring, and just like, we're going to do what we have to do to take care of you. And I just remember it was like, okay, now I felt like kind of like a robot. Okay, we're focused. Now we know what's going on, what the diagnosis is. We got to go move forward. Okay, what's the next test? What's the next test? But inside I was sad. Inside I was hurting. Inside I was like, I should tell my husband to move on. Those are the things that were going on inside. But outside I'm smiling. Okay, what's the next appointment? What do we have to do? What's next? And when the doctor said, when I had my pap smear, that they couldn't see my cervix, well, that's because both of my cervixes are at 9 o'clock. So when you look at a clock and where the 9 is, of course he couldn't see my cervix, because both of them are up to the side. And next was Clomid. So she said, we're going to remove endometriosis around your fallopian tubes, because endometriosis was literally, and my uteruses and my fallopian tubes were just entangled in endometriosis. She was like, yes, it was just overwhelming. But my right cervix was closed. So before we got to Clomid, I had to have another surgery to open my right cervix. And I had to have a Foley tube, I think it's called a Foley tube, to hold it open, to keep it open for a period of time. And then every 6 weeks after that, I had an injection without anesthesia to keep my cervix open because it just wanted to close back up. Yes. So that when they saw the ovary, I mean, not the ovary, the cyst that grew from a tennis ball to a grapefruit. Well, that was my right uterus filling up with blood. So all those years, my right uterus was filling up with blood. And then when I would have those horrible accidents at work, at school, when it couldn't take it no more, everything would come out. So it's just all those things piled on top of each other. I thought I was losing my mind, but again, I'm smiling like everything's fine. Okay, what's the next appointment? And so finally she said, let's do Clomid. Since you can't get pregnant, we've still been trying to get pregnant after I healed. And she was like, let's try Clomid. I said, fine. We did Clomid for months, doing Clomid, taking the pills, Clomid, taking ovulation kit, doing the ovulation kits, doing the pregnancy test, getting blood work, still not pregnant. So she was like, well, you're not a candidate for IUI because the instrument does not fit in women that have double uterus. Things that are not talked about. Little things you don't think about. It's like, wait, certain instruments don't fit into my anatomy. And so I'm like, that alone, I was like, well, what do you mean? She was like, no, I cannot do IUI. But what we can do is IVF. Now, I know I'm saying this story fast, but this has been years, 6 years, this whole journey, my husband and I being married and trying to get pregnant. This has been years, ups and downs. I'm gaining weight, losing weight, taking birth control pills to try to fix my ovulation. And it's a lot. And so next was IVF. And so my husband and I for sure thought, IVF was going to be the way to go. Like, this is how we're going to get pregnant because all the other ways haven't worked for us. Naturally hasn't worked for us. So we were like, well, this has to be it. So we went, I remember going to work and then going to get blood work and then, just rigorous appointments back to back and just making sure I keep it on my calendar and make sure I don't miss an appointment, doing all the things I need to do, picking up my medication and, and then finally my husband doing the injections for me because I was just scared to do them myself and just watching my poor husband giving me the injections, and finally we ended up, I think it was 19 eggs and 6 were viable. And they took his sperm and, and we had embryos and my doctor said, we're going to only transfer 1 because it's a possibility the embryo can split. But for you, the thing that's not talked about, when women have 2 uteruses, we can get pregnant in both uteruses at the same time and it's not twins. I didn't know that. This is like, I feel like I was a guinea pig. So many medical students and so many doctors were coming into my appointments to just look at me and to be a part of the process. So because there's not a lot of women that are diagnosed with this. And so she said, we're only going to transfer 1 embryo. And she sent me to the facility to have the transfer done. And I remember having the transfer and the doctor that was doing it, he was trying to get the speculum on my cervix. But like I said, both of my cervixes are at 9 o'clock. And I remember him trying and how painful it was. And I'm watching the screen while the nurse is holding the ultrasound probe on my belly. And I'm watching the screen. And I'm like, is he going to get it? Like, that anxiety of, I know my cervixes are not where they're supposed to be. And I'm watching the screen and I see the pressure on his face, like him trying and trying. So finally he was able to get the embryo where it needs to be. And I remember my husband and I were just so, happy and just getting ready and just feeling like, oh my gosh, this is it, And I was a little crampy, but I was excited. And I remember the nurse said, we'll call you soon and give you the results. We're going to call you this date and time. So my husband and I both rushed home from our jobs. And I remember us being huddled on the couch and kind of like what I'm doing right now, being huddled on the couch with the phone. And she calls and she's like, Mr. and Mrs. Douglas, I just want to let you know it's negative. And I was like, no, wait. This is the only way. This is the only way we can conceive. The only way. There's no other option. I remember, this yell, this welling cry that came out of me. I can hear myself, but the pain I was feeling, I couldn't speak. I just dropped the phone and my husband finished talking and I was just screaming. Like, with all that we've been through, I've been through 3 surgeries and all the diagnoses and all the procedures and MRIs and blood work and all that I've done. And now you're telling us that we're not pregnant? The depression, the not woman enough, the girl with bad periods. See, I'm a woman and I cannot do the thing that we're told that you're supposed to do, be fruitful and multiply. I can't do that. And I remember telling my husband, move on. You would have had 2 or 3 children by now. You are wasting your time with me. Wasting your time. I was to a point, I was so depressed. My husband was working night shift. And it was just me and my dog at home. I remember walking to the kitchen and pulling up each knife. Okay, this one is too straight. Okay, this one is too short, but this one's serrated. This one would be sharp enough to cut my throat. Like, literally, that was my lowest. Like, what else can happen? Why am I here? What, all the things that were in my mind that I was kind of like pushing back, now it's in the forefront. The dark cloud that was kind of just a little, over here, but the sun is still shining. No, it was a dark cloud over my head. I wanted to just kill myself. And I remember God said to me, your life has a purpose, Leanna. Hope still stands. My middle name is Hope. Didn't understand what hope was until that moment. There is still hope. Even in my pain, even in the uncertainty and not feeling understood and feeling like I'm not woman enough, there was still hope. So I put the knife back down in the butcher board. A few weeks later, my husband said to me, I love you with or without children, because I was still trying to push him away. He was like, I love you with or without children. And I needed to hear him say that. I needed to hear him say, no matter what, if we have children naturally or not, I still love you. And it was like a light bulb went off. Wait a minute. He still loves me. He's still here. Even though we've gone through so much, and physically I've gone through so much, my hormones are up and down, my mood is up and down. He's still here. Wait a minute. I missed that. I was so focused on, like, I have to give him a child. But when it's supposed to be us, I was focused on giving him a child, but not realizing, wait, no matter what, he's been here every step of the way. So I needed that. I remember for 6 months, we just loved on each other. He just said, let's not even focus on having children right now. Let's just love on each other and just enjoy us as a married couple. Literally one day, it was July 5th. I'm laying in the bed. I think it was July 5th, 2012. I'm laying in the bed and I wake up and I'm like, I should take a pregnancy test. I have to go to the bathroom so bad. Why do I want to take a pregnancy test? I don't know why. All the other times it's been negative. I already know this. So why do I want to take a pregnancy test? And I remember reaching over to the left side of the bed and I look and my husband's not there. Well, he's downstairs with the light on. I said, baby, are you okay? He was like, yeah, I'm fine. I'm just downstairs. I was like, okay. I said to myself, I'm just going to take a pregnancy test. I'm not going to tell him if it's negative. He doesn't have to know. But why do I want to take one? I'm like actually having a conversation with myself. Like, Anna, you're crazy. Why are you taking a pregnancy test? This has been 7.5, 8 years. You haven't gotten pregnant. So why are you taking one? And I go in to take a pregnancy test and I'm like, sorry, it's so much coming out of me. I'm like, why do I have to go to the bathroom so bad? What is this? So I take the test and I put it to the side. I said, Anna, don't look at it. It says to wait 3 minutes. Don't look. And I literally look right away. And it's 2 lines. What does that even mean? I've seen no, I've seen 1 line. Like, what does 2 lines mean? Blown. And so I start screaming. I'm like, oh my gosh, what does that mean? And my husband runs up the stairs. He was like, what's wrong? What's wrong? I said, baby, I took a pregnancy test. And he's like, why? Like his face is like, why did you take a test? You know? And he's like, what does that mean? I said, well, it says 2 lines. What? So he looks at the box and looks at the test. He was like, baby, you're pregnant. I was like, no, I'm not. You're lying. He was like, no, the box says 2 lines means yes. The test says 2 lines. I'm like, you're lying. I said, I'm calling my mommy. I call my mom. I'm like, mommy. I'm like, mommy. I just took a pregnancy test. She's like, you did? And I said, there's 2 lines. You're pregnant. I said, no, mommy, I'm not. She said, yes, you are. And I said, mommy, get dressed. This is early in the morning. We get dressed, all of us shower, get dressed. I pick her up. We pick her up, go straight to John Hopkins. And they're like, we don't have any ultrasound today, Mrs. Douglas. I'm so sorry. And I'm like, no, I'm high risk. I need to know if I'm pregnant. They said, we will get you. No, now, right? Now. They were like, we will get you in tomorrow. So the next day, I go in for ultrasound. It blows my mind. And there's a heartbeat. 8 years of trying to get pregnant. And there's a heartbeat. What? We were in such shock. What? Naturally, by God's grace, naturally, after 8 years, if I would have gave up hope and killed myself, my 11-year-old would not be here. Woo! There is still hope. There is still hope. Now I have all the odds against me. Endometriosis, fibroids, 1 kidney, 2 uteruses, 2 cervixes, and I had a baby. What? Hope still stands? That's why my platform, Hope Still Stands, is for a reason. You will still be standing no matter what you face.
And it's still, I have chills. I have so many chills. That's an amazing, incredible story.
Thank
As
you.
far as then with the pregnancy, were you worried, or how often did you have to make sure, were you getting more checkups more frequently?
Yes, I was high risk because the thing was with if I got pregnant in my right uterus, because I had the right cervix, opened, I would have to be on bed rest and have a cerclage, but I was pregnant in my left. Like what? 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 So she was in my left uterus, but I still had to get, frequent ultrasounds, just be checked and my blood pressure checked. But I did have high blood pressure. And they said that's one of the things with having whole bunch of reproductive health things going on, high blood pressure. And I'm already kind of, like finally we are pregnant. I'm like cautious and, so, right. So I ended up having her at 32 weeks. I had her early. I had preeclampsia. That was a lot. That another thing that's not talked about.
What advice would you have for those watching about becoming your own advocate, especially when it comes to being in a doctor's office and knowing something is wrong, but not necessarily being heard?
Mm-hmm. Yes, it's important to advocate for yourself. It's important to write down every question. No question is stupid. Like you can ask whatever question that you have on your heart, and also ask if someone can come with you. Sometimes you're uncomfortable when you go into the doctor's office and you need that support. Even if they can't come into the room with you, maybe that friend or family member can stay in the waiting room, so you know that okay, that support is there. You know, ask if you can record the session. Sometimes I voice record because they tell you so much information and you get overwhelmed. So it's okay to maybe ask. If they say no, that's okay. But try to write down whatever they're saying. But please advocate for yourself. It's your body. Use your voice. Don't feel that you have to suffer in silence. I suffered in silence for too long. I don't want anyone else to suffer in silence.